All right, we're going to get started here in just about 60 more seconds. Because there are so many of us in the Zoom call today, my recommendation would be in your top right-hand corner of your screen. If you change your view to speaker view, that way you will be able to see the person who's speaking directly, as opposed to seeing the gallery or the Brady Bunch view where you see everyone's face and we're all kind of just spread all over. That'll make your viewing pleasure a little bit better today for today's Net at Noon. All right. And with that said, I would like to welcome everybody again today for today's Networking at Noon that's focusing on COVID-19, business reopen and recovery. Today, we are very fortunate to have our panelists, Ms. Jennifer Tavares, the President and CEO of the Tompkins Chamber, Mr. Gary Ferguson, the Executive Director of the Downtown Ithaca Alliance, Ms. Heather McDaniel, the President of Tompkins County Area Development, and Jason Molino, the County Administrator. Today, we'll just kind of go over some topics of up-to-date information on Phase 1 and Phase 2 reopening of industry sectors and their requirements, considerations for new processes for workplaces, employees, and customer safety, and we'll have time for some Q&A at the end of our networking session today. This Networking at Noon is being recorded today, and this video will be made available on the Chamber website afterward. If you have any questions, please feel free to post them in the chat box, and our panelists will be able to address those throughout the duration of the webinar Net at Noon today. And again, if you have not, I would recommend, you don't have to, but I would recommend go ahead and shifting the view to speaker view so that you can see the people that are speaking directly as each panelist takes a turn to present. All right, and with that said, I'll be more than happy to turn things over to Chamber President, Ms. Jennifer Tavares.
Thank you so much, David. Appreciate the intro. Thank you everyone for being here today. We've been rapidly shifting all of our programming and content at the Chamber, and obviously the most important thing that we can do is try to bring you up-to-date information about both circumstances on the ground, and also as we look forward, our economic recovery and how we're all going to start revamping our businesses and get our operations going under what is new normal. And a lot of additional guidelines and restrictions and requirements that everyone is going to have to operate under. And so our organizations, all of us together, I can say this confidently, the Chamber, TCAD, DIA, Tompkins County, the City of Ithaca, Workforce Development Board, every single organization and government entity in Tompkins County that is responsible in some way for economic development, workforce development, community development, are concerned first and foremost with getting you information as quickly as we can, but also making sure that you take seriously the recommendations that are coming down from New York State. We've stressed this in a couple of educational sessions thus far. One of the key concerns that we have is that everyone does take the time to read the state guidelines for their industry sector, understand which industry sector they fall in or which phase their business will fall in. We recognize that that's not always easy, and the information is not forthcoming as quickly as we would all like it to be. So there's a number of things that every business or organization needs to do in order to reopen and to be sure that they are complying with all of these new guidelines and that they're reopening in the right phase. And it really is a circumstance of the public health concerns come first, as much as we all also very much appreciate the economic concerns and what everyone's going through. The public safety concerns and being sure that everyone is set up to keep their workforce, their customers, all of our visitors healthy is the first. So I want to allow some time for each of our panelists to share their perspective on both what these new requirements are in these key industry areas, phase 1, and also looking towards phase 2. and also their observations of how things are going so far, and share some of their insights, because every one of us is on the ground to some degree or another trying to help all of our stakeholders interpret all of these new guidelines, understand how to create their new safety plans and their new operating plans, how to go about attesting to the state that they've done so and that they're prepared to open and serve the public. And really, again, really everyone's going to have to be rebuilding from the ground up in a lot of ways. And we certainly recognize that we need all of our resources and all of our knowledge to continue moving forward together. So first, what I had hoped was that Heather McDaniel, who is the president of TCAD, could share with us a bit about her observations and also recommendations for the manufacturing and construction industry sectors. Those are two of the key sectors that were allowed to begin opening with phase one. There are pretty thorough sets of guidelines and restrictions on those sectors now. So I'm going to turn it over to Heather to share more with us about manufacturing and construction in this new world. Heather?
Thank you, Jennifer. So I, TCAD, have held some focused groups meetings with manufacturers, with some of our larger construction industry partners. And through those conversations over the last several weeks, have learned that many of the manufacturers and many of the contractors have already been operating as essential businesses or serving essential businesses. So they have been, for many weeks now, putting together and revising their own operating plans. The key thing that I'm hearing is that health and safety is #1 priority, not only for employees, but for customers, for those that do have customers coming through the door. So again, many of the manufacturers, the contractors have been grappling with how to phase back in their workforce, how to operate with a smaller workforce over the past several weeks. So that phase one opening date of last Friday was not like a magic switch everyone turned on and went back to work. We did receive the guidance from the governor. He started really filling in the blanks on what the state wanted to see and was going to be requiring in their operating plans. So, businesses have been able to see those on the New York Forward website, and hopefully they've all gone up and attested that they have all the requirements in place. In terms of best practices, we have really been focused on providing the information from the federal government, particularly from the CDC, from New York State, from New York Forward's new website, as well as directing folks to the County Department of Health. Those three places, I think, really have the requirements that businesses are going to meet moving forward. I will say that, New York State is still continuing to fill in the blanks. They have put a lot of that information up for the phase one businesses. We're still sort of waiting for the phase two businesses. But for any of you that are in phase 2, 3, 4, and you're thinking about reopening, you can very easily go up to the governor's site and look at what they're requiring of the phase one businesses. Many of their requirements are very similar, if not the same, so it gives you a good idea. All the requirements really are organized around people, places, and processes, and give you some key ideas of things that you should be thinking about. One of the things that we did, I think it was posted just this morning, all of the service provider partners in Tompkins County, we've been meeting weekly, and over the past week or so, we put together a list of all those federal, state, and Tompkins County requirements and guidelines, as well as a list of industry tools and guidelines from industry associations, everywhere from professional offices to retail, construction, all kinds of good things up there. It went up on TCAD's website today. I think the partners are probably posting that as well. in terms of hearing from some of our industry partners, health and safety is the most important thing. And, you know, we're all in this together. We're all learning as we go, what best practices are, and just adjusting as best we can as the days move forward. And I think that's sort of my overview for today.
Great, thanks, Heather. I'm sure we'll have some more questions and come back to it. I think one of the things that we've heard most often, and I'm sure you have as well, and this sort of ties back into something that you shared, is if my business was already an essential business and I've been operating this whole time, what do I do? What do I do differently? You know, for everyone who's been operating as a designated essential business under the Empire State Development Guidelines, there is not necessarily alignment with one of the phase 1 industry sectors. So if for some reason you are an essential business and you see that you fit into one of those phase 1 industry sectors, then that is the guidance that you should be using, and that is the attestation you should be submitting to the state, and you should assume that you should be compliant with those guidelines, and as soon as possible, submit your attestation that this is what you're doing, right? Get your safety plan done, be ready to go. There are some notes in the FAQ on Empire State Development's website for what to do if you're an essential business, but you're not clearly listed in one of those industry sectors. So folks can go and read some of those suggestions there. It's sort of a sit tight, keep doing what you're doing until there's clearer guidance for your industry sector. I haven't heard anything new or different in the last couple of days on that. Have you?
No, just yesterday I was hearing that there will be additional guidance for essential businesses, but it has not been posted yet.
Great, thank you. Thanks so much. Next, I'd like to go to Gary Ferguson from the Downtown Ithaca Alliance. I know several of you were able to attend last Friday. Gary and I and Tom Knipe from the city of Ithaca, and I think a few others, did a pretty deep dive into phase 1 curbside pickup and delivery guidelines for retail. Again, I know many retailers have been sort of with one person running into their business and able to take some orders and pack some things and either ship them or deliver them. Some people have been doing very minimal operations along those lines. But now there is a 15-page long set of guidelines for that industry to start operating more regular curbside pickup and retail. And I'm sure many of you that this might apply to have seen that the DIA and the city of Ithaca have worked together to identify some additional parking spots in the downtown area to facilitate curbside pickup. We have a pretty thorough PowerPoint that's an overview of all of those guidelines, but again, just would encourage anyone in that industry category to read those guidelines and be sure that they're really actually ready to open. One thing that we're all, I think, quite concerned about is people assuming that light switch has flipped and they should just go ahead and start operating again, and not realizing that there's a significant amount of guidelines and regulations and you know, preparation that they need to make in order to operate safely. So Gary, I was hoping that you could tell the group a bit more about what you've been seeing and the kinds of questions that you've been getting from retailers downtown, and maybe what you would be advising folks to be doing right now. And as we look forward to phase 2, when we switch from curbside only to full retail, but with a limited percentage of traffic in stores, you know, what does that look like under the Downtown Ithaca lens?
Sure, thank you. It's everything changes so quickly. It's so hard sometimes to keep track, but the retail sector was certainly hit very hard, particularly the local retail sector. Big box stores obviously often, you know, had sort of an edge in terms of being able to be considered essential. So many of them were able to keep going, but most of our communities, you know, hundreds and hundreds and hundreds of small retailers had to shutter. And so that's been a major issue for folks. And I think the key thing here is really survival. trying to minimize your expenses as much as you possibly can when virtually no income was coming in. And I think people have been trying to do that. And you know, as we get ready to come out the other side, at least on phase 2, we get to see you know, how people have been able to do that. Recognizing that even when phase 2 opens up and people can legally open their doors, it does not necessarily mean that there will be a mad rush of people running into their businesses. And that's something that I know we at the Downtown Alliance have been thinking about. So retail, I mean, maybe just focus a little bit on retail. They split it into 2 phases, interestingly enough. The first phase in phase 1 was all about, as Jennifer said, curbside pickup and in-store and curbside delivery and in-store pickup. That, and then phase 2 was really for all retail. So what was interesting about phase 1 was that the state came out with a very elaborate series of guidance, recommendations, and mandated requirements that have to be adhered to. And I can just summarize some of the key ones for you. I mean, one of the key things for certainly as it relates to curbside and in-store, that does not mean that customers can go wandering around in the stores and sort of shop. It means that transactions are handled remotely. And in case of curbside, the proprietor brings the goods or products out to the car, either at one of our locations downtown, or if it's somewhere around the county in your parking lot, or you know, at the roadside. In the case of in-store pickup, it means somebody comes to your door or comes to your counter and has already purchased or is purchasing something that's already been ordered, and they just complete the transaction. That's very different from what will happen in phase 2, when businesses will be allowed to open their doors and customers will be allowed to walk in and walk around and shop in the way we probably more normally anticipate. One of the things that in phase 1 they specifically said was that there was an expectation that you wouldn't bring more than 50% of your workers back as a retailer, that you could make do with at least half, up to half of your workers. And obviously there was a lot of provisions for making sure you were socially distanced and spaced and had the proper PPE and everything else to do the work that you had to do. There was certainly strong recommendations that people try to use touchless payment systems, although that was not mandatory. But certainly I think in the eyes of many, it makes a whole lot of sense. They also recommended that to the extent that you could, you tried to stagger your customer arrival times so that you didn't have multiple customers showing up at one time and creating a situation that makes it difficult for spacing to happen. One of the things that I think is that certainly retailers and really all businesses will have to adhere to is that employers are expected to provide PPE, particularly masks, and in some cases gloves, for their employees. And so we anticipate that there's going to be, as phase 2 comes around relatively soon, there's going to be, you know, literally in Ithaca, in Ithaca and Tompkins County, thousands of businesses scurrying around trying to find PPE. And statewide, there's going to be millions of businesses scurrying around trying to find PPE. So I expect that to be an issue, and hopefully we can work our way through it. And I know the county has had some, so hopefully that's something that will sort of ease that burden for a lot of people here. The other things I think I wanted to mention was that, I mean, one of the things that I think we're certainly struggling with and trying to understand better, and I think the state guidance on phase 2 will hopefully deal with this whenever it comes out, will be that issue of how do you deal with touched, handled, and returned merchandise. You know, for a lot of us, maybe not me because I'm a terrible shopper, but for many of you, shopping is a tactile thing. I like to feel it, touch it, check it out. And in the age of pandemic, that creates some issues. So we're anxious to see from the state's perspective. I mean, I know a lot of our businesses downtown have begun thinking about this, and there are different strategies that different people are thinking about. But it'll be really interesting to see how the state, guidance, whether it's mandatory or recommended, deals with this issue when those phase 2 guidelines come out. And then I guess finally, I think the other issue was that every business, whether it's retail or otherwise, is going to have to deal with some kind of screening assessments. And that's going to be mandatory and some sort of signage. And we have already started talking to our businesses about what they have to do and how they have to do it. One of the things that we are looking at downtown, and frankly, we would invite others to join us if they're interested on this, is we are coming up with a marketing and branding program we're calling the Ithaca Promise, which is designed to essentially help our small businesses, wherever they are, engender some level of trust and confidence in the community. It is a difficult thing sometimes for people to consider sort of starting back up. And so this idea is one that is an effort to help people better understand what businesses will be doing, and conversely, what businesses expect their public and their consumers and their patrons to be doing as well, so that everybody can be safe. Let me stop there.
Thanks for that, Gary. I do think that, everyone being on the same page and as unified as we possibly can, as far as businesses and organizations and nonprofit organizations and local government, et cetera, the more we can all be on the same page and speaking the same language and having similar expectations of workforce and of consumers and visitors, the more successful we will all be. And so I think we're all interested in working together on that. I'd now like to introduce Jason Molino, who is the Tompkins County Administrator, and he's got a pretty cool mask he's sporting there. It's not on his face, but it's like a superhero mask. That's pretty. Thanks for showing us good mask wearing practicing, Jason. So we invited you here, and I'm so glad you could make some time for us to share more from your perspective as county administrator and on behalf of the legislature, just everything that the county has been doing. And you don't need to tell us everything because I know it's been a bit of a whirlwind for a couple months, but your perspectives on all of this from a county perspective, certainly your advice, maybe anything that you're seeing so far now that we have started this new phase. And you also sit on the regional control room too. So anything you're comfortable or able to share that would enlighten folks as to what's going on and when we can expect more information about future phases, I'm sure would also be appreciated. So go ahead, Jason.
Thank you, Jennifer. I appreciate the opportunity, and thank you to you, the Chamber, TCAD, DIA. You've all been wonderful partners in this and in giving good advice to our community partners. So the phase 1 has opened in our region. Quick recap: phases were granted, or regions were granted the ability to reopen through phase 1 based on meeting 7 healthcare metrics. We were one of the original 4 or 5 to achieve those metrics, and we continue to maintain the milestones that the state has put out there in order to stay open and hopefully then graduate into the next phase. And I'll talk about that in a little bit. So in this case, phase 1 started last Friday. The state put out that guidance that everyone has talked about so far on the New York Forward webpage about guidelines for each industry, reopening templates, and then also the testament or the attestation or affirmation sheet that you all have to complete as small businesses as part of that phase, or any business as part of that phase has to complete. So that came out on Wednesday before the Friday. I'm hopeful that phase 2 will come out a little bit more than a day or two before phase 2 goes live. That's the biggest question we've had. So I would expect that something will happen in the next few days. I don't have confirmation, but just knowing that the state's been at this now for at least a week, I would expect something on phase 2 to come out very shortly. Then the next question is when does phase 2 take place, or when do we go into that next phase? And I think while there hasn't been a set schedule, or there hasn't been set confirmation, the expectation is that if we can maintain the healthcare milestones throughout a 2-week period of time after phase 1 opens, we would then graduate into a phase 2. And the reason for that is that you'll be able to monitor if there's any negative or adverse impacts health-wise in the community due to the phase 1 reopening. And that usually takes anywhere between 6 to 12 days. So if phase 1 opened on Friday, Saturday, Sunday, I would expect at the beginning of next week, we may start to see if there is any adverse impact. The first sign would be an uptick in positive cases, right? An uptick in positive cases, which then may follow with an uptick in hospitalizations. That's how this process would work. So assuming we can maintain those milestones, one would say that the next phase could then be reached, whether that's right 2 weeks into it or whether it's 3 weeks into the phase 1, I don't know yet. The other unknown is what happens with Memorial Day weekend. So as you may be aware, Memorial Day weekend has been probably the largest step into a relaxing of these regulatory environments that we've had so far. So there are beaches that are now open with certain capacity limitations. Memorial Day ceremonies, meaning official ceremonies in honor of Memorial Day, can have no more than 10 people attending them. Just for your information, that does not include your backyard barbecue. That is not a Memorial Day ceremony. It may be to us individually, but it's not to the state. And a Memorial Day ceremony would be a flag raising or lowering, honor guard, that type of thing. And then also religious venues can have no more than 10 people, and they can have drive-in and parking lot services. Again, in the situations where you can have no more than 10 people, mask wearing, social distancing is still a requirement. So what point of being is that what will determine whether we go to the next phase of things is whether or not the current phase triggers an uptick in cases, which would be the first sign that there's been a negative impact or a adverse impact of reopening. Even if there is an uptick in cases in the region, which is important to understand, it's the region, it's just not Tompkins County. It will then depend on how much of an uptick and whether or not it's consequential against the milestones that the state has set. So that is why, if you go to the New York Forward webpage, daily those milestones are updated so you can see and follow the county and the region as to how they progress. And they even have some more granular detail information on the county stuff. So that's kind of an overview. There is one important tool that is now online, although it's still being refined, and that is businesses can search by, and help me out, Jennifer or Heather, business code to determine if they're in the phase. I forget the acronym. I don't know if you can share with me what that was again, but
it's a NAICS code. So they did create a lookup tool for businesses to try to find out whether they are allowed to reopen and what they need to do. I will say I played around with the tool in a few different ways. The best thing would be if you know your actual NAICS code, and if you don't know it, Google and try to find it so that you can type your code directly in and search your industry sector directly. It's a little bit more difficult if you're trying to poke around under the search functions because the descriptions in there don't necessarily apply to everyone, and I got wildly different results depending on exactly which set of answers I gave. So we can put a link to that tool in the box as well. I definitely still think, because if you get a no you're not allowed to reopen answer in that tool right now, it actually doesn't necessarily take you to more information very easily. So one thing I wanted to recommend, again, to anyone who is not a phase 1 business or already operating as an essential business, that you really look at the guidelines that are already up there for phase 1 industry businesses. Read through those guidelines, because, for instance, if you're thinking you're going to open more for phase 2 retail, you very much should assume that the absolute minimum baseline of what you will need to do is already in the guidelines that are posted on the website. even an office operation might want to assume that those guidelines are going to be the bare minimum, or very similar in some cases. Obviously, you're not delivering things to the curb if you're in office, but you know, there's certainly going to be a lot of similarities across industry sectors related to workforce, related to testing requirements, et cetera, et cetera. So, you know, the more time people have to prepare for what the guidelines might say when they come out, the better. So thanks. Back to you, Jason.
Yeah, no, it's one of the tools that they have available for people to determine whether or not they fit within it, but it's not a perfect tool, and we've identified there are updating it daily to try to make it more refined. One of the things that's come out of a question that we are involved in is enforcement of these guidelines, and enforcement primarily of mask wearing as social distancing. And as you begin to look through those guidelines, those individual businesses, whether it's phase 1, 2, 3, or 4, are going to have requirements that those businesses are going to be required to enforce mask wearing and social distancing, both with employees as well as patrons in their respective businesses and organizations. And this is going to come more, I think, more specific with retail as that opens up for phase 2. But it's going to be an important piece of the discussion that we have, and it's an important piece of our messaging from the county, and that is, this is really a personal responsibility initiative. We need everyone, whether they're patrons, employees, or employers, to take the personal responsibility themselves to ensure that they're wearing their face masks, they're wearing their face coverings, they're employing the social distancing. The enforcement mechanism comes back to us to be able to follow up on calls, complaints, and questions about, you know, this was going on in this circumstance where these folks aren't complying. And the way we've handled this to date from a compliance perspective has been very, very successful. And it's generally around education. We reach out, we have respectful conversation and dialogue, whether it's with individuals, whether it's with business owners, organization heads, and we talk about the importance of it. We inform them. In many instances, they weren't fully informed of either the executive orders or, in this case, the guidelines are put out. And we work with them to make sure that they try to comply with it. That has been the most successful mechanism we've had available to us, and we'll continue to employ that. And we're going to continue to push out some different messaging as we move forward, making everyone aware if they're not aware, because some people still aren't, talking about the importance of face covering. You know, I'm wearing my mask to protect you, and you're wearing your mask to protect me type approach, and still push on the education piece as the way for compliance. We do have other enforcement mechanisms, and we've been asked about this, so I'll share them with you. It's what our last resort is from an enforcement perspective, and we have not had to employ it, and hopefully we won't. We do have the ability to issue civil fines. There is a penal code violation with respect to gatherings, and we also have the ability to shut businesses down if they're not complying with the reopening plans and the attestations they make, which is agreeing to the guidelines and maintaining social distancing and masks. I mention that only because we get the question, although we have not exercised those authorities, and I'll be honest, this is the absolute last thing we would ever want to do, and we have no intention of doing it if we don't have to. Again, we've had the greatest amount of success in communication, talking with folks. Most of it is done through our environmental health folks, but a lot of it is also done through different law enforcement. Particularly with construction, it may be more building code or building officials or code enforcement officers of those municipalities. But we've had, I don't know, a few hundred complaints, inquiries, and we've been able to resolve just about all of them through simple communication and education. And that is the tactic we will continue to employ, and we'll continue to make a heavy messaging, a public messaging effort over the course of the next few weeks. And you'll see that coming both out of the county. You'll see it coming from Frank Krupa, our public health director. We're going to continue to push that because we think that's the most effective way to get compliance is through the education piece. A few other things I'll add, and then I'll open it up. Again, personal responsibility is key. Phase 2, I already talked about that with respect to when the expectation is. An essential business question, this was talked about earlier. So one of the confusing parts about essential businesses is, and the state has said this to us, but yet they have not, and this is in the regional control rooms, but they have not provided a venue for it, is essential businesses will be required to put together a reopening plan and attest to it. There is no mechanism right now to do that for an open essential business. So following a lot of guidelines of similar industries where the guidance is put out there, but it should be forthcoming in the next week or two where essential businesses will go through a very similar process to those that are allowed to open through phases 1 and 2 and so on and so forth. So that's forthcoming. I think the guidance everybody's giving you here now is reviewing those guidelines. There's a lot of overlap. There's a lot of similarities. And if you read a few of them, you'll get an understanding of the tone and the expectation of what's to come, even if it's not specific to your industry. And there's an opportunity for you to begin to prepare and start that planning. Either start the planning of your plan that you probably have already started to execute if you're an essential business, or two, if you're phase 2, 3, or 4, you'll have that preparatory process already begun. So that's the only things I have, I think, to add to what everyone's mentioned. I listened in on the chamber call a few days ago with the DIA and Tom Knight. Thought it was really good. And I think that's a great asset to continue to have these calls and calls like that to answer any questions. So I'll leave it at that.
Thank you so much, Jason. So we have a follow-up to that session from last Friday happening tomorrow. I did just put it in the chat box. We're going to try to share some different information and look at some different aspects than we did last Friday, which was like sort of a really rapid fire overview of almost everything that's going to be required of retail businesses in this first phase. A lot of the other resources, people were asking for links to them. So we've tried to keep up with the questions in the chat and put links to everything that all of us have talked about. I think what we'd love to do is to open this up to additional questions from folks, which folks could either use their reaction button to, I think I'm going to try to go back to the grid view here. If folks wanted to use their little reaction button at the bottom of their screen and do a little hand raise, or if they want to raise their hand in the participant section. I'm not sure if that's an option right now, David. But we'd love to make sure that any other questions that folks might have, to the extent that we can answer them, that we will. Just to reiterate again, the question came in again about phase 2 or essential businesses. And really, I think all of us are in agreement. Our recommendation right now is to take the time to review the guidelines that are posted on the New York Forward Industry section site. Look at the guidelines that are most similar to your industry sector, or look at a couple of them if you want to be safer than sorry. And just, you know, if something completely doesn't apply to you, like if you don't do anything retail oriented, then the retail portion probably doesn't apply to you. But I would assume that most of the recommendations around workforce, around what your duty as an employer is, there's a lot around the public health, the health and safety aspects of this, which, you know, again, we have a program coming up in the near future to dig deeper into the health and safety aspects. There's a lot of recommendations around testing and around duty to report for workforce, and around what the employer's obligations are should you have an instance of COVID-19 in your workplace, et cetera, et cetera. So those aspects of the guidelines, I think, are very helpful for any employer or any business or organization to be reading through right now, understanding what's going to be expected of you or what you need to be expecting of your employees, and thinking about how all of those things are going to change your operations. This is, from an HR perspective, this is a very new world, because things that normally an employer would not be allowed to ask their employees, and they wouldn't want to be asking and tracking and keeping track of in their HR files, are now things that it's going to be, the onus is going to be on you as an employer to be asking these questions daily, to be doing daily health screenings. You also are going to need to be really strict with your employees about their duty to report to you if there's any reason why they might be at risk, or they've been in contact with someone who has tested positive for COVID, or if they are among a group of people that has been recommended to be isolated by the county health department, for example. You know, it's important to think through those things with as much lead time as you can before you actually need to be restarting your operations. So let's see, we have a question about, are we legally allowed to refuse service to those who refuse to wear face coverings? Jason.
Well, I don't know if you're legally allowed to, but I can tell you that you're attesting to it as part of your reopening plan that you're going to enforce it. The legal question is probably better left for a lawyer. I will say that The question around is everyone required to? Yes, there is also concern, and this is where we talk about respectful dialogue on the issue. There are some people that, from medical reasons, can't wear a mask. And so there has to be an understanding of how you approach these situations. The assumptions can't be made necessarily just on its surface or what the optics of it are. And again, that's going to be part of our messaging, is about essentially the respectful dialogue around the circumstance. So again, personal responsibility is a key component of it. And businesses are going to be required to attest that they're going to enforce it as part of their reopening plan.
And I've heard from certainly at the DIA, we've been meeting with a lot of businesses on a regular ongoing basis. And this is probably their biggest concern, and one of their biggest question marks is, you know, we've heard that very few public entities want to be the enforcer. It sounds like the county kind of has to be the enforcer of last resort, but thinking about how one deals with this question in your business when it will arise is a real important one. And I think, you know, I would urge everybody in their plans to think that through. What do you do? How do you do it? What's your sort of protocol? What's your sort of process? I know Jennifer and I are talking about the idea of maybe trying to put together some sort of additional session that might deal with how do you even from a customer service standpoint deal with stuff like this? I mean, this is a real hard question. And you know, we've seen cases around the country where it's gone badly. And obviously, you know, we don't want to trade one public health issue for another. Yet, you obviously know that this is a real crucial part of what the reopening program is all about. So I would urge everybody to think real carefully about this, because it will be an issue and it will come up probably in your business in some way, shape, or form.
I can ask that question also.
Talked about quite a bit, as well as you know, again, arming your team with the language that they need. They will definitely need some training on this. It's obviously, you know, having the right language and being able to say the right things without someone getting defensive or angry, or, you know, people getting anxious is certainly, again, a new world that we're in. One thing I did want to just circle back on that Gary had said about the 50% occupancy. The recommendation was, it was not just for workforce. So as we looked at phase 2, it was combined 50% of your typical occupancy, accounting for your workforce and your customers. It was total occupancy. At least as far as how I read the guidelines. So again, I think if you're looking towards phase 2, regardless of what type of operation you are, I would be preparing for possible guidance around what total percentage of occupancy in your space. And again, looking at how do you manage your workflow? How do you space out your employees? How do you space out your customers while adhering to guidelines around 6 feet of social distance, potentially having to put up new partitions or barriers between workstations if you can't maintain that social distance. Those are the kinds of things that there's actually some pretty specific guidance about in those guidelines documents. And again, thinking through these as early as possible if you're planning towards early June for a potential reopening. And I think just really briefly, I want to share some of what we're doing as an organization at the Chamber, because we're an office setting, but we also have retail and we also have visitor centers, and we're looking at these each of these components of our business operations are separate in some ways, although they all work together in the same spaces, and they very well could each have different sets of guidelines and maybe under different phases for reopening. And so those are things that we're thinking through. I'm sure most of you realize, depending on what type of workplace you are, that the guidance still from the state is not the minute you're allowed to open, every single person should be back to work in the same space together. And I'm sure many of you, depending on your workforce needs, have already realized that that might not even be a luxury that you have, and that you may not be able to invite everyone universally back to work in the same spaces at the same times, because as employers, we're in a little bit of a new world of needing to be flexible in different ways that we maybe haven't needed to be in the past. And so, you know, we're looking at continuing remote work for a very long period of time. We're looking at staggering who's in the office, who's working from home, adjusting our schedules and maintaining those lower thresholds of people in the workplace. And frankly, because of potential issues with schooling and childcare, and also having some people in high risk categories, we need to really be making our plans in such a way that we can accommodate all of those people's needs as we come back to work together, and also operate our business and our organization. And so those are just some other themes that I would encourage people to be thinking about if you aren't already. Surveying your employees, or making sure you understand what everyone's circumstances might be. Projecting out for the period of time when you might be trying to reestablish your somewhat normal operations or quasi-normal operations definitely should be part of your planning. Jason, were you going to jump back in with something?
I don't remember.
I'm sorry.
I might
it might
have
been about mask enforcement or lack thereof.
I don't remember. Sounds good.
We've had some questions about consistent signage and some posters, etc. So the county has some posters that could be used that are on your Moving Forward website. So the link for that is in the chat as well. People can download those. I think it's possible there may be a version made available at some point that would be easier for someone to also add their logo to. I know that's something that's come up. I don't know. I don't want to speak for you. A couple of other groups have also been talking about creating some signage and making it available as well.
Yeah, so the signage we have on the website can definitely be used. It's got, I mean, it has the public health, stamp on it, so to speak. Anybody can use it. You can easily alter it or add your own. I mean, it's a simple PDF. So if you want to add your own logo to it, it's not copyright for any matter, but it's a good, easy visual, and it's a good visual that we'll be using. So the common, visuals of the mask, the hand washing, so on and so forth, will be something that we'll start to see a lot. And I think the more familiarity people have, whether from establishment to establishment, the better it is that it resonates with folks, right? So by all means, print it out, use it, blow it up, shrink it down, whatever works for you. It's up there for the community to use and to access. And I mean, for example, the airport is using it, and it's gonna, hopefully as activity picks up, a lot more people will see it that way. So feel free to use it as much as you want. That's why we put it up there for everyone to take advantage of.
Great, thanks, Jason. Another question that came in is, and I do think this is correct, masks are only required if 6 feet of social distancing cannot be maintained.
Yeah.
How does that jive with the idea that we should be having signage outside that says we're expecting people to wear masks and we're hoping that they're going to be prepared to walk in with that mask, right?
Well, I mean, it brings the question of, can you guarantee that you won't run into anybody or within that 6-foot barrier no matter where you go? And absent of being in your own home or being in your own workspace, no one's around you, I guess that's right. I mean, if I go downtown to go shopping, I go anywhere, what's the likelihood that I'll be able to keep a 6-foot perimeter around myself at all times? Probably not likely. And if I'm talking about, most retail, it's probably not likely as well. So, and to be honest with you, you probably don't want that. I mean, you want to be able to have more people in your establishment. So while that is the executive order, it's not likely. And then if you can't guarantee it, what happens when you aren't going to be able to maintain that? So the expectation that people are going to be having a mask on them is pretty much, I think, a reasonable expectation. Even in our workplace, we're requiring it in the workplace outside of their workstation. So if I go to the printer now, that's why I have my mask on right now, because I have to go to the hallway. I'm not going to be able to guarantee I'm not going to run into somebody here. So that is, the executive order. What's the likelihood that you won't be able, what's the likelihood that you'll be able to guarantee you won't run into anybody and break that 6-foot barrier?
Especially in most, certainly in most retail environments, it's nearly impossible to guarantee it unless you only allow 1 or 2 customers in at a time. You know, if you have aisles and you can make things one way, that's another idea that you can manage flow perhaps. We have a question about testing as well. So there's definitely been some differences in recommendations that have come out around testing. We are very fortunate in Tompkins County to have a substantial capacity for testing, probably far more now, especially since the county, thank you, has agreed to purchase additional testing equipment from Rionics for use in conjunction with Cuba Medical Center. We could be testing far more people per day than we likely are right now. There was obviously a swell last week after a case was identified, and there was a public health recommendation that people who had been in a particular store at various times would go get tested. But Dr. Stallone from Cuba Medical Center had issued a recommendation several weeks ago that all currently essential workers and also that anyone who was going to be going back to work as part of phase 1 could be tested and should be tested. CMC is definitely supportive of and has recommended that employers support this policy and help you know, ensure that their employees are tested. There's a question about frequency. I don't know, you know, I don't want to put you on the spot, Jason, but I don't know if you know the answer to this question.
Sure.
Should people be retested every 2 weeks if someone is implementing a testing program?
Right. So you know, probably from a science and health driven perspective, yes, you know, testing frequently and often is a good thing. There are several factors that go into that. So one is, you know, requiring employees versus encouraging employees are two different things. There's probably a legal question as to what you can require your employees to do based on circumstances and not. And I would encourage you to ask your legal counsel as to how you want to employ that. Because there's, you know, what we've done for the county and most of our workers that have been working today are essential employees. What we've advised them is we will provide you with the opportunity. You can get tested. Since it's during the workday, Monday through Friday, we provide 2 hours of leave to get tested once. If they so choose, and if they choose, they work that out with their supervisor. That's our policy as a county perspective. Obviously, that doesn't mean, that is aside from the fact that if you are symptomatic, you should definitely get tested. And if you have been in contact with someone who's a positive COVID case in the past 14 days, you should get tested. And those have, you know, those are continual criteria that have been there. What has expanded the criteria is the essential worker eligibility and now any worker in phase 1. That's an individual employer decision to be able to test and how frequently you do test. So I can't opine on it, but I can say what we've done from a county as an employer perspective. And then also, there's a sampling element, which is what the Ithaca Mall drive-through is. It's a sampling. They take the sample there. And then there's the actual processing of the samples, which is similar to what the Rionics equipment is doing. So the legislature approved the purchase of an additional Rionics equipment to partner with CMC. I believe the city Common Council is going to entertain the same thing. There are several other funders that are looking to do similar. What that does is it allows more samples to be processed quicker here locally versus sending them out to a lab. So turnaround can be quicker. That bolsters the capacity locally. That's a good thing. About whether or not you want to employ a 2-week retest of all your employees, I think that's an individual business decision based on the amount of exposure those employees have, both with the public and each other. And it's probably partly has to do with internal policy as well as maybe some legal counsel advice as to what you can require to do and what you can request to do. Right now, there is the only mandate I'm aware of employment-wise, our nursing home staff have to be tested twice a week. And that's from the state of New York. Outside of that, you know, unless you're exposed or along those lines, that's the only mandate I know of employees right now.
I posted a few resources in the chat box. It is our understanding, again, that employers can require this. This is very atypical from, you know, anything I think any of us are used to. I put some resources here for anyone who wants to read up more on this. And obviously it's an individual decision for your particular workplace and organization. I think, you know, absolutely great advice, Jason, considering the circumstances, the interaction with the public, how public facing or how frequently the employees are interacting with customers, or how many people need to be in a space operating together on a daily or weekly basis. All should be considerations. Fred, thanks for putting a little message in the box here. I will just say there are a lot of local businesses that have PPE and supplies available. There is also hopefully still some mask supply and hand sanitizer supply available through the county. If at any point that's not the case, let us know, Jason. We have been sharing in every chambergram all of the members that we're aware of who have PPE, and also signage, or, you know, some people need stickers for their floors to help people understand social distancing, et cetera, et cetera. So we have a lot of folks that can provide those services. Anyone interested in custom branded masks or something fun like that, there's certainly several options as well. And we've continued to include the link to fill out the county form to request the, not the prettiest sort of like Hanes t-shirt variety mask, but they work just fine. And also the state issued hand sanitizer as well. So thank you for all of your questions, everyone. If you have additional questions that we weren't able to answer today, you could certainly send them to us at the chamber. We'll do our best to get you answers. Again, we're going to continue to have webinars with deeper dive focus areas on several of these topics, including more on the health and safety with a couple of members who have expertise in that area. As Gary said, talking more about arming you and your employees with the tools that you need to manage some of these conversations, and have that mask discussion, probably what will be several times a week at some point in the near future. So David, I guess I'll turn it back over to you for some closing thank yous and wrapping us up. Thanks again to all of our panelists.
Yeah, thank you to everyone for being here today. As Jennifer just pointed out, we are having on Friday, May 22nd, Reopen and Recovery Retail Unpause. I did put the link to that webinar so you guys can register for that in the chat box. That's this Friday. Next Wednesday, Reopen and Recovery Health and Safety, partnering with Patrick Molin and food and beverage lecturer from Cornell, Ms. Lily Jan. That will be next Wednesday from 12 to 1. The link to that webinar is in the chat box as well. Just want to say a huge thank you to our sponsors for Networking at Noon: One Step Coaching, CFCU Community Credit Union, Hilton Garden Inn, Schwab Walker, and Sheldrake Point. Without their continued sponsorship and support, none of this would be able to happen for the community. So again, just remember the chamber, we're here for you, wishing you all safety and health, and just continue to persevere as we all endure this together. You guys have a great rest of your Thursday. Have a great Memorial Day weekend, and we'll see you guys soon.
Thanks, everyone.
Bye, guys.
Have a good day.